So if after going through the assessment you've worked out that we may need a little bit more mobility in these feet, you may need it on both feet, you may need it more on one than the other, we're going to get started on our self-treatment techniques. And the first one is a series of self-massage that I love to use, and dancers love it because you can feel an almost instant improvement in your range in most cases. Now, a lot of people ask me if we have magic cream. It is not magic cream. You can use any cream you like for this, any massage cream that you can find at the pharmacy, or you can even use coconut oil or olive oil if you need from the kitchen. You just want something to give a little bit of a slide so that we're not getting too much friction on our legs. But I have a couple of rules that we need to follow when doing your self-treatment. Now, the first one is don't rub where it's sore. So if you have any areas that are a little bit tender or you tend to get irritated, make sure you go above and below that area, not directly on it. If it's already tender, there's often some inflammation or some tissue damage there. If we press it too much, it can make it worse. So please avoid those spots. The other is that it should always feel good after. We're going to retest your range after we've done the massage, and it should feel good. If it doesn't, then you may want to make sure that you're following all of my instructions, but you also may need to drop off your intensity. This is not something that we need to do very hard. It's more about getting hydration into these tissues and making them able to move a little bit more. So let's give it a go. You're going to take some cream, and I want you to put it on the back of the hand of the foot that you're going to massage. So since Solana had a little bit less plie range, on this side we're going to do our left foot. So then we take a little bit of that cream and we're going to smear it up the inside part of your cuff. Now, you have a perfect inbuilt massage tool in your hand. So if you hold your hand up, down your pinky finger side, you have a little lump of bone down at the base of your wrist. This is called your pisiform. Place this bone behind your inner ankle and pop your elbow off out to the side. Then gently start sliding up behind the shin bone. Now, the example I like to use here is imagine your leg is made of chocolate and you're melting it with your hand. Please do not rub aggressively. You're using the heat from your hand to melt your way through your deep calf. Make sure you're right in behind that shin bone. Beautiful. And it's just waiting for the tissues to melt before we push through. Don't be too aggressive. You want to be nice to your legs. Beautiful. And we can just do a little bit of a stripe up there for 3 or 4 repetitions. Now note if there's any tenderness along the way. So say you come up and you feel fine, and then there's an area that's a little bit tender. Remember I said we don't want to go aggressively into that. However, what you can do is come a little bit back from it and use a gentle trigger point. So if I felt an area of tension, I can come just below it. See if I can find a little trigger point there. Focus on my breathing, breathe in. Breathe out, see if I can let my leg relax. I usually say it's an internal process rather than really massaging the tissues. We're asking the tissues to let go. Try another breath. And release. And then one more. And release. And then work through that area again. And you may be surprised that sometimes it feels a whole lot nicer coming through the second time. Next, we want to move on to the sole of the foot. So you're going to take a little bit more of your cream, place it on the sole of the foot. Now, most dancers massage out their inner arch, and we can do this. However, there's an area that I don't want you to touch. If you come just forward of your arch, just about here, there's a very complicated point of anatomy called your node of Henry. This is a crossing point of lots of tendons, a couple of nerves, and it's quite tender. So please don't press directly on that. I find that most dancers actually need more work through the outer part of the foot. So we're going to use pisiform again. Flex your wrist. We're going to come through the middle of the arch and along the foot. Now focus in the beginning on the bit of the foot that doesn't really touch the floor. So you'll notice that your foot has a few different colors on it. Go on this most pale area here. Beautiful. Then along the outer border, I find best if you use your 2 fingers to go through to get a little bit more strength along the outer border. Now, especially if you notice that you tend to hold your weight on the outer border of the foot, that some of us did in our assessment, you might find that that is a little bit tighter. We're always aiming for resolving tight muscle rather than pushing into pain. The other area here that a lot of dancers need, especially if you've been struggling a little bit with your point range, is a band just in front of the heel. So for this one, I like flexing the thumb. Now, make sure that your thumb doesn't hyperextend. We want to keep it a little bit bent. Pressing with the thumb and then supporting with the other fingers. And we're just going to do some small stripes, about 1 inch or 2.5 centimeters in length, moving from the front of the heel forward to the foot. And I find this really helps people who have been struggling getting that last little bit of extra point range. So if this is an area that felt a little bit tight for you, you might want to give it a try. Just make sure when you're coming up on this inner part that you're not going up to that tender spot that I mentioned before. Now, the great thing about doing your own massage, it's a great way to improve blood flow into here. It's also more effective if you are focused on your breath. So as you're working through here, I want you to focus on gently breathing in through your nose and either out through your nose or mouth. That part doesn't matter. I find that if you are pressing too hard, you'll tend to hold your breath. So keeping a focus on your breath will make sure that you don't go too aggressively into your foot. Beautiful. Then we're going to work underneath the big toe, but we need to be a little bit careful about this. If you pull your big toe back, you should be able to see or feel a line of tendon. Now, don't massage this. This is your FHL tendon. However, we can take 2 fingers. Either side of that tendon, I'm going to come from underneath my big toe, coming up either side of that line. Beautiful. And then you can do that under the other toes as well. So if we peel back those other toes, you can use an index finger, just releasing under here. Now, especially if you've been doing a lot of foot training, you may get a little bit tight in this area. Really nice just to get a good bit of blood flow and fluid flow into this area of your foot. Beautiful. Then place the foot onto the mat and tuck your other foot underneath. Now, take a little bit of extra cream. We're going to put it on the top of the foot and up the front of your shin. Perfect. Now, this one's a very interesting one, and a lot of dancers are really tight in this area. Take one index finger, place it between your first and second toes, then the other index finger on the top. Now, we're massaging up between these 2 toes, just up until you run out of space, which will be about 1/3 of the way up your foot. Don't bother about massaging up into here. That's where the bones are. You can't do any benefit from coming up there. Just stay in the gap. You can stay directly in the center of the gap. You may also try rolling your finger in and coming up the inside of your big toe or up the second toe as well. Now, a lot of people may feel some points of tension here. Now, this is the one spot that I will actually let you stay on. So there's a Chinese medicine trigger point in here, liver 3, that has wide-ranging benefits in the body. If you feel one particular spot about 1/3 of the way up, you can hold pressure on that. Breathe in, breathe out, and see if you can imagine your foot melting. You may feel a little bit of tenderness under your finger, but a lot of people will also feel it radiating in underneath their foot. This is okay. Normally I don't like radiating things in your feet, but this one I find can create a huge amount of space. After about 3 breaths, it should start melting away. So whenever we are holding a spot, we want to make sure that it's feeling better over time, not worse. Beautiful. And then move through again, and it should feel a lot nicer. Then you can go between your second and third toes, and just a couple of stripes on each is good. Between 3 and 4. Beautiful. And between 4 and 5. Just noting any areas that are tighter for you. Then, coming up into the shin, have a feel of your shin and make sure you can identify where your shin bone is. Now, we don't need to massage bone. So we want to avoid that hard part, but this muscle that's over here, this is the one that a lot of people use to try and lift their arches, and it can get a little bit tight. Make your right hand into a fist, place it on, then your left hand with the cream can go over the top. Then we're going to very gently come up through the muscular part, which is a little bit more to the outside of your shin. This should not be painful. If you've had issues with your shins, you want to go very, very gently. You may have a lot of tension built up here. I want you to think of flushing the area with fluid rather than breaking down any tissue with the massage. Coming all the way up to your knee, beautiful. Okay. Lovely. Then we end up being in the reversed position to when we started, with the legs rotated this way. Going to use that last little bit of cream behind the ankle or all the way up. Then in this position, I find it more comfortable if you lean back on your opposite hand and pop this hip slightly forward. Then we can use the same hand to do a gentle little release behind the ankle bone and up the first lower 1/3 of the leg. Now this is your FHL, one of the muscles that scrunches your big toe. So if you have been curling it, it may feel a little bit tight. And then you can continue that all the way up to the outside of your knee, through the perineals, those muscles on the outer part of the lower leg. Just nice and gentle. Again, the heat of your hand melting those tissues all the way up. Beautiful. So that's a nice little sequence that you can do. Give your foot a little bit of a wiggle. Yep. Then pop up into standing and just see how that feels, going into your plie, pressing into the plie. And does that feel? So much better. Yeah. And then placing it up on rise and just seeing how everything slides and moves. Often just gives it a little bit more hydration. How does it feel? And then we want to retest our total wall that we did before to see just how much improvement we've had from that simple massage sequence. So Swana, coming and placing your big toe behind the one on the left where we were before, that was her maximal range, and plie down. How does that feel compared to before?
Much better.
Yeah. Then shuffle back and see just how much further we can go with the heel still on the ground and the knee touching the wall. Beautiful. Just starting there. Yeah. So if we have a little look at that, we can see that's actually just a little bit better than her right side now. Just take the foot away. And if we measure that, and that's over 2 centimeters improvement, which has taken it more than the right one. So this is obviously a great thing to do on your left foot. We may like to also try it on the right and see if we can have some improvements there as well. So the next question I usually get is, well, how often can I do this? If it has this great impact, can I do it all the time? No, please don't. My usual rule is that we only do any of the hands-on massage work every second day. So if this works for you, great. You can do these areas every second day. Please don't do it every day, and please don't do it multiple times a day. The reason why is we don't want to get any irritation or inflammation of those tissues. And my rule is that if you have an area that feels like it needs to be massaged, we actually need to find the reason why that's getting tight. So while you may do the massage on one day, on the next alternate day, we're doing an exercise to stop that area from getting tight in the future. So please don't go overboard. A lot of dancers love doing the massage and tend to do a little bit too much. So the other question that people often ask is, well, when do I do this? Do I do it before class? Do I do it afterwards? Do I do it on the weekends? And this actually depends on your foot type. So if you find that you have slightly restricted range, it's a little tricky to point your foot or to plie, it is a very good idea to do this in the morning when you're preparing your body for class, so that we're getting as much range as we can so that you can use it in class. However, if you have very mobile feet, you do not want to do this before class, because then you'll often have a lot more uncontrolled range and you may feel a little bit more unstable in class. You'll probably want to do it after class or on days that you're not dancing. So you can give them a gentle work through on a Sunday when you don't have class, or maybe a Wednesday afternoon that you happen to have off. This ties in perfectly with the sequence that we're going to explore in this program of our mobilize, isolate, integrate function. So this is an ideal mobilizer to get started with.